and how brilliant to see so many of you as I click through my screen from all over the country and the world, actually, which is brilliant during Creativity and Wellbeing Week. So what a kind of inspirational start to what can be the hump of the week on a Wednesday, isn't it? And actually, this is great. So it's brilliant to have you all. So I'm not going to sort of do too much else, as if apart to say that I'm currently one of the associates at the National Academy for Social Prescribing, and was previously COO there and executive director at South Bank Centre. So creativity and health is absolutely the heart of what I do. But really, we're here to hear from our panelists. So let's kick off with the first question. And as people are going to be answering the questions, it would be great if you could then introduce yourself and your organisation as you answer it. So the first question that we have is, what do you think are the biggest challenges and opportunities in creative health right now? And we're going to start with the Creative Health and Wellbeing Alliance. So I'm going to hand over to Victoria.
So as most of you know, the Culture, Health and Wellbeing Alliance is a membership organisation. We have 7,000 members around the country, most of whom are delivering creative health work, lots of freelancers, lots of small arts organisations, museums, and many colleagues who work in health or social care or in research. Yeah, and we're free to join, so do join us. We'll put the link in the chat if you're not already a member. I think to answer the question, I've been trying to think about this in a way that isn't too big picture, but I have gone a bit big picture. For me, the challenges and the opportunities in some ways are the same thing. And I think in some ways that hasn't really changed for the last couple of decades when I've been working in this area. And it's about creative health in some ways running counter to the prevailing tendencies to work in silos, for example, so that you've got health over there, creativity over there, education over there, sustainability over there. Very often that means that creative health kind of bumps up against the prevailing political or economic direction. And this whole idea of using creativity to and our imaginations to support health, or coming together across different communities, or telling stories that are about empathy or complexity or nuance, that can at times feel quite oppositional to some of the rhetoric that we hear coming out of government, for example. So most recently in this country, we've been hearing quite divisive rhetoric about immigration, for example. And I don't want to overclaim for creative health and pretend that it's the answer to all of this, but I think the drive to do this work often comes from wanting to find some community with others, or to value experiences that have been pushed to one side for whatever reason. And that can make for a sense of purpose, but it can also create quite a lot of isolation and confusion. And we've seen quite a lot of burnout over the recent years. It's also a sector that tends toward quite sustainable models inherently. And creative health people tend to be very good at making amazing work out of very few physical resources. There's not much of a carbon footprint. There's a lot of recycling. But most importantly, in my experience, it's very generous sector when it comes to sharing knowledge. And there's a kind of...
Now, let me stop distracting you.
Hi, David.
Sorry.
There's a sort of disinterest in intellectual property, for example, but there's a lot of interest in sharing great ideas. And I think that sort of willingness to share presents a bit of a challenge to our tendency to venerate property or push toward growth for growth's sake. And the real opportunities are that we're already modeling a different way of being in the world, I think. So maybe I'll stop there because I don't want to take up too much time.
Great, thank you so much, Victoria. I think I'm now going to hand over I'm going to hand over to the National Arts and Hospitals. So Guy and Laura, I've lost people on the screen.
Yeah, so we're here today from National Arts and Hospitals Network. That's myself, Laura Waters, and Guy Noble. So we're co-directors. So the National Arts and Hospitals Network is the professional network for arts managers. And although we're working in hospitals, it does feel like we have that sort of wider reach into the community as well. So whilst we work across all of the UK, so we've got members in Scotland and Wales, and we're getting into Northern Ireland as well. But today's focus is going to be on England, because that's where most of our members are. And I think at the moment, that's really where there are the challenges that I want to talk about are happening in England. So a problem we've got at the moment in hospitals is how we remain relevant and visible in the face of all the changes and upheaval that's been happening recently. So the biggest one for us in hospitals has been the dissolution of NHS England, which has had an enormous ripple effect, and down into ICBs and into trusts at a local level. And this has created a sort of real uncertainty in arts programs around jobs and resources and funding. So in a way, I feel like we're sort of, back to square one about sort of fighting for our existence slightly and thinking, where are we going to get funding for programs? But I'm saying that on the flip side is that in the last few years, creative health has also really grown and developed, and there's a lot more evidence now and a lot more interest in it. And so I think we are in this situation in a much better place than we might have been a few years ago. Since the pandemic, there's been a lot more interest from staff and patients, and a greater understanding of the benefits. And also, I think there's a lot more new programs starting in hospitals as well. So it's not all negative. So although I feel as if we are in this sort of stage of upheaval and difficulties, I feel that our starting point is better than it used to be. So yeah, that's where we're at. That's the biggest concern. And Guy is going to speak about another area of concern for us. Over to you, Guy.
Thanks, Laura. Good morning, everyone. I'm Guy Noble. I work at University College London Hospitals NHS Foundation Trust. My pronouns are he, him. I'm a middle-aged man with grey hair and wearing a green shirt. And also I co-chair with Laura the National Arts in Hospital Network. So for me, I suppose, chatting with colleagues, I think there are many challenges of working within hospital arts, but the one I'd like to focus on is perhaps a fundamental one. And I don't think it's really about proving our worth, but really transforming how we work. So for decades, as Victoria has already mentioned, we've structured our programs around institutional boundaries, and we've become experts at creating healing environments within hospital walls, developing interventions for patients during treatments, and working within clinical settings. But I believe this institutional mindset is deeply ingrained in our operational models, our funding strategies, with reliance on our hospital charities, and perhaps also our professional identities. And I don't think the real difficulty is convincing others of creative health's value. It's reimagining our roles and taking others on that journey with us, moving from being providers of hospital-based arts programs to becoming connectors in a broader health ecosystem. This requires a profound shift in how we think and operate, and possibly some training on how to do this. It demands that we step beyond our comfort zones and develop new and/or revisit existing skills in community engagement, partnership development, and system thinking. This way of working isn't simply about extending our current programs outward. It requires us to reconsider our entire approach, to see ourselves as part of a neighbourhood health network rather than a hospital service. It means sharing power with community partners, aligning with local priorities rather than institutional ones, and blurring the boundaries between patient and community. And most importantly, taking our charity funders on this journey with us. Yet this necessary shift in our working model creates unprecedented opportunities. The health system around us, as already discussed, is evolving, with integrated care boards increasingly focused on place-based approaches and prevention. The NHS long-term plan has established a vision where hospitals are no longer isolated treatment centres, but integral parts of neighbourhood health networks. I believe by transforming how we work, we can position hospital arts programmes as vital connectors between clinical settings and communities. We can develop dynamic partnerships with local actors, from grassroots arts organisations to GP surgeries and health centres, creating pathways for people to engage with creative health activities before they even become patients within the hospital. As I'm sure you'll all agree, our hospitals function as anchors within our neighbourhoods. They have spaces, resources, and relationships that can support community-led creative initiatives. And by adopting this way of working, we become bridges between institutional healthcare and grassroots wellbeing efforts. I've spoken with many colleagues around this, and it's clear that there is a desire to evolve our practice. But I think there's an uncertainty as how we move from being hospital arts managers to becoming creative health connectors for our entire neighbourhoods. I think it's clear that this needs to be a shared load and a shared collaborative conversation. We need to develop the systems awareness and community relationships needed to work in this more integrated way. But this takes trust, and trust takes time, but it's time worth investing in. The challenge is significant, but the opportunities to reimagine creative health as a truly preventative approach has never been greater. Thank you.
Great. Thank you so much, Guy and Laura, and actually some really important points there. I especially like your point around the ecosystem, and actually it is about how we transform our work and being seen as being sort of vital in that system going forward. And we know we've got that opportunity coming up with the 10-year plan that will be published soon. Now, I'm afraid I got the order wrong slightly, so I'm now going to hand over to the London Arts and Health. So I'm going to hand over to Anna. So apologies, Anna, for not getting in exactly the right order. There were lots of letters coming at me. So over to you.
Absolutely. No worries at all, Sunita. Thank you so much. I'm just, really, really pleased to be here. I hope you can hear me okay, everybody. So yeah, I'm Anna. I'm from London Arts and Health, and we are a sector support organisation based in London. We do what it says on the tin. We cover London, supporting the creative health sector there, but we also help to deliver Creativity and Wellbeing Week, which is obviously a kind of national festival of creative health. And we are in the middle of Creativity and Wellbeing Week right now, which is amazing to see all the kind of events and enthusiasm, knowledge sharing and power and collective around creative health happening right now. So I'm going to talk a little bit about some of the kind of challenges or maybe opportunities in creative health that we're kind of wrestling with in London. And the first thing I want to just touch on actually is training. So I think that comes up again a lot for our members, and I will offer some solutions or ideas around this later on this webinar. But I think there's two things going on here. First is kind of this idea of skills. So what are the tools that you need in your toolbox to be a really good creative health practitioner and to work in this workforce? How do you make sure that you know about safeguarding, that you're kind of caring for yourself and your participants, thinking about things like trauma-informed training or mental health first aid, all the different kind of components of the skill set that you need. But also something we've been reflecting on a lot at a sector level is this idea of core competencies. So some people might call those the kind of soft skills, but I would say the essential skills, like the makeup of the sector. And also, how do we get to a point of kind of collective agreement about those core competencies? And how, as organisations, can we provide spaces and places to test those out, to kind of have some trial and error, to fail and to learn and to kind of grow as a sector? I think that's really, really important. And the second thing I just want to touch on, which I talk about a lot, is representation. That's quite an umbrella term, but I'm thinking they're really about anti-racism practices and also the diversification of the sector. So there's a couple of programs that we run at London Arts and Health that I'll tell you a bit more about later on in the call. But we had a very soft launch yesterday for Advocates for Representation in Creative Health, which is a steering group that we help to manage, where we're really thinking through some of the challenges that particularly our senior leaders in creative health who are ethnically diverse are kind of rubbing up against continually again and again. And a really good provocation came out of the launch yesterday. If you were on the call yesterday, it was a really, really fantastic discussion. And that was really around like how many creative practitioners or, you know, wider cultural kind of workers don't identify with the creative health sector. And we think that's a real problem, actually, because we often talk about scale and reach and kind of we're at this tipping point in creative health. It's a really exciting time. There's a lot of people that just don't even know about the terminology, don't understand that way of working, but they are doing that kind of practice in their organization or their creative work or their setting. So it's about building a really kind of transparent and open and invitational sector, I guess. So I'm kind of, wrestling with those ideas a bit at the moment, Sunita. So I'm going to hand back to you. Thank you.
Thanks, Anna. I think that point about language, and actually I'm going to use the word semantics, although that's not to reduce it, but actually it is interesting when you sort of share the language that sometimes clinicians need to hear, or ICBs need to hear, and the language we use in creativity, there's actually a bit of a translation we need to do, isn't it? Actually, and a lot of organisations are doing some of this great work already. Thank you so much. So I'm now going to hand over to Claire Lovett from the Mayoral Creative Health Network. Over to you, Claire.
Thanks, Anita. Really fantastic to be here. My name's Claire Lovett. I work at Greater London Authority, and I sit within the Creativity and Culture and Creativity Industries Unit. But I'm here as one of the 10 Mayoral Authority founder members of this newly established Mayoral Authority's Creative Health Network. Our network was born out of a discussion between Julie McCarthy in Greater Manchester and myself. And to speak to the challenges, we were recognising the need to find more ways of joining up best practice and building our capacities to support us all to embed creative health into regional strategies. What we were discovering was that the lack of capacity was creating barriers to long-term planning and investment, and it was limiting coordination and engagement with academic research. All of this really started to slow further progress and kind of had a drag on the momentum that was building. So with the generous support of the Arts Council, the network was formed at the end of 2024. And it's a new network, so I thought I'd give you a very brief overview. It's built together with health and culture officers, and we work across creative health strategy, cultural policy and practice, as well as really focusing on health inequalities and regional growth programs. There are 10 members, as I've said, so excluding London and Manchester. We also have fantastic colleagues in Liverpool City region, North East, South Yorkshire, Tees Valley, West Midlands, West of England, West Yorkshire, and finally York and North Yorkshire. And we've got the potential to grow over the next 18 months. So some of the things that we are looking at in terms of challenges, I caveat this with the newness of the network, but our meeting at the end of April in Birmingham agreed the following 4 areas that we were witnessing. So how do we generate momentum to move from creative health being a nice to have to a need to have? How do we use the newness of the network to respond at pace as things are shifting and changing, as we're hearing, and as we're establishing our connections? How do we address the lack of capacity to embed creative health in strategic planning, and what could we do together to shift that? And how are we responding as a network to the government plans for devolution and growth planning? And we looked at 4 areas of action, but I'll leave that there to come back to in the opportunities side.
Great, thank you, Claire. And so brilliant to see this work having such a permeance in terms of policy and practice, and also having that vital conversation at government level too. So thank you. I'm going to hand over to Alex Coulter now from the National Centre for Creative Health. Over to you, Alex.
Thank you, Sunita, and thank you to everyone for having this event, which is really great. I'm Alex Coulter. I'm the Director of the National Centre for Creative Health. I'm a white, older woman wearing a dark blue jacket and dress with whitish hair. At the National Centre for Creative Health, our mission is to advance good practice and research, inform policy and promote collaboration, helping foster the conditions for creative health to be integral to health and social care and wider systems. And we also provide the Secretariat for the All-Party Parliamentary Group on Creative Health, and we work closely with the other organisations represented here today. I'm going to talk a little bit to the question about challenges and opportunities, and then my colleague Jane Howard will answer the second question, which is what we are doing in response to them. As several people have mentioned, there is a lot of churn and change in the public sector, not just in the NHS, but also what's happening with local authorities and devolution. And that is both a challenge and an opportunity, as we all recognise. The changes do seem very dramatic at the moment, but they never actually stop. And I think that is something we've got to really accept, is that it is about a context in which there is constant change, and we need to work with that reality. And although most of us, some of us, don't work for a public sector organisation such as the NHS or a local authority, we are actually part of the health landscape if we think of health in its broadest definition. And we are therefore part of that change, and we are already having an effect on that change. And I think it's a real opportunity for us to take a more proactive role in that change. Guy mentioned systems thinking, and the new ICB blueprint that's come out has quite a big piece about systems thinking and requires ICB employees to be up to speed on that. And I think it's really important that we are too, because systems thinking gives us a position in the systems. So rather than thinking of ourselves as outside these health and social care systems and this sort of siloed structure, we need to think about ourselves as part of the change and part of that landscape, which is constantly shifting. So although our work, we all know, is very niche, is very small, we don't feel we have much power, and it's not mainstream, this is a great opportunity because of what's going on and the pressures on the system. So it was interesting to me that one of our trustees, who is a chair of 2 NHS trusts, recently said, the current position for the NHS, with the rundown of NHSE and the substantial tightening of budgets, is, in my experience, paradoxically creating a potentially beneficial effect in as much as real alternative pathways and services, rather than purely belt tightening, are being considered. Then another challenge, I think, which has been touched on, is the sort of challenge of supply and demand. So I'd say we're definitely seeing a growth in demand, but we do have infrastructure and capacity issues in the workforce. And that is obviously very profoundly linked to issues around funding. I'm really surprised no one's mentioned that yet. So the challenge of how the work can be funded. And I won't talk in any detail about that. We can obviously discuss it in the breakout groups, but it was interesting to me that a report we recently commissioned from the North of England Commissioning Support Unit, which is an NHS kind of support unit, we asked them to look at commissioning, so specifically commissioning from health for creative health. And there was nothing unexpected. In some ways, it was quite reassuringly predictable, what they said, what they found out. But one main takeaway is the need for the cultural provider sector, broadly, to be better networked with the wider VCSE sector. And I think that, that's something we can all consider in terms of it being a separate challenge, particularly for the cultural sector. I think, as several people have said, there are real opportunities in keeping up to date with what's going on with the 10-year health plan, which is due in June, and the focus on the 3 shifts. And if you think about the 3 shifts, we have something to contribute to all of them. There is, when you read the detail, say on the government website, it does feel very health like NHS in its conception, but I think it's our task to show people that it is broader. So the 3 shifts, which you may all be familiar with, are moving care from hospitals to communities. So that's a real focus on prevention. And what Guy was saying about more integrated work across our networks at place-based neighbourhood level is something I think we can really all work on collaboratively. Making better use of technology is how they're now referring to it, although originally they were saying from analog to digital, and then focusing on preventing sickness, not just treating it. So that's all I'll say about the challenges and opportunities, and Jane will pick up after the break.
So yes, does anybody want to kick us off with some responses, either in the chat or verbally from the breakout sessions you've just had? So in our group, we talked about funding and training, both in terms of career pathways. Exactly. Are those definitely something that needs to be happening there in terms of the workforce? Angie, your hand's up. I'm going to come to Angie first. Hello, Angie.
Hiya. So we had a nice chat with Annie and Rory in our group, and we talked about some opportunities I thought would be interesting to flag, which were about kind of evaluation as a rewarding experience for the kind of participants and the people leading it, so you can get the best from it for sort of funders and policymakers. So thinking about encouraging more visits to the work and sort of better storytelling to not quantitative stuff but more qualitative stuff. So there were just a couple of opportunities I thought I would flag.
Great, thank you very much. And that's actually really important. I love that point that the evaluation is part of that rewarding experience. That's actually really fundamental, but also gives us the core data and evidence we need to continue with our lobbying on this. Just a couple of things in the chat: the roles of City of Culture and the example there of Coventry being mentioned, and the impact of London Borough of Culture. We've got plenty of hands up. Let's go to Nick first. Nick, you're up.
Yeah, I'll not speak on behalf of the group I was with, but I just wanted to raise one of the points that we didn't have time to discuss, and I'm keen to hear what other people think. That obviously there's a big move in the system into community care from acute, and the transition, however that happens, is going to be interesting. But in the context of this, that transition to community often goes hand in hand with prevention. And prevention, from what I can tell, often goes hand in hand with cost saving and cost measures and reducing expenditure for the system. And I'm thinking about how that's so difficult to demonstrate for anyone, let alone this type of activity. But also thinking about what are the treatments that the regulators for health system agree and approve that maybe do not reduce the cost, but improve outcomes. So that's a question in my mind. But also, why is it that we as a sector have to constantly justify ourselves in an economic model rather than a social model? So there are more questions than points of contention, let's say, and I'm genuinely interested in that regulator approval process.
Great, thank you, Nick. Some really interesting provocations there, and I'd be interested to see people's thoughts on that in the chat. I'm going to take the 4 hands that are up, and then I'll move us to the next bit so that we keep on track timing-wise. So Lucy Zakaria, I hope I've said that properly, but Lucy, over to you first. Then we'll go Salah, Sarah. So Lucy.
Great, thank you. Hello, everybody. Great to be here with so many of you. We had a really lovely chat. And one of the things that did actually came up was about how many networks there are and navigating those networks now, because it seems like there's more and more, and it's getting difficult to know necessarily exactly where to go. So was a question around kind of connecting people more widely, and we discussed the difficulties between the primary and the secondary care network. So I work in a similar role to Laura and Guy. I'm part of the National Arts in Hospitals network. And we have been actually working quite a bit in the community because our programme extended to community arts engagement about 3 years ago. But we've really struggled to connect with the social prescribing part of the work that we do. So that's been one of our biggest challenges, and it was discussed that we share this between us, so that in a lot of cases we have the patients and the participants who want to take part. There's often even the funding on the table, but it's actually then connecting the providers to the patients and things like that, which there still seems to be a big disconnect around. And one of the opportunities that we saw potentially for this would be to have champions from within the actual healthcare system, so from within the NHS itself, because otherwise the narrative always seems to come from us, the arts and the creative health people. So I hope that's fully representative of my little group, which was great. Thank you.
That makes sense, thank you. And just to say, NAS does have some social prescribing champions that are both clinical and non-clinical based, so I can always share a bit more about that. Let's now go to, I think I said, is it Salah I said next?
Yep.
There's various hands that are moving around. Salah, over to you.
Yeah, no, just really quickly, I think a lot of that was spoken with the presentation, I think resonated with the group. So we recognise some of those challenges. We also talked about the kind of fragility of the system. So, you might have one key person. If you lose that key person in your region or your town, the whole system collapses. So there's something about the kind of fragility and how do you create resilience within that. which then comes down to obviously resources and how do you resource the connecting of the dots, I think is really key around that. And there was one solution, well, talking from issues to solutions, I guess. I mean, there is some power of collective working, and if you're able to create a group of ECSC arts organisations together, obviously the voice is a lot louder, and you can prove obviously your impact much better. So there is that power in collaboration, not just with the usual suspect, but trying to kind of scope what that looks like a bit more widely as well.
Agreed. The power of our collective energy and momentum is absolutely fundamental. Thank you, Salah. And then I've got one more hand up, and it says Arts, Culture and Wellbeing Scotland. So I feel like I don't know your name. I'm really sorry.
It's Nancy.
Nancy, over to you for our last comment.
So
Thank you, Nancy.
in our group, again, it did start with funding. We talked about challenges of embedding and sort of encouraging investment, and some of the challenges, especially on kind of freelancer level, of constantly looking for their own funding, and that tends to be kind of pilot projects, or themes or activities. So there's no sustainability in those. And then I think we also then talked about the connection between, even if we're looking at policy or strategy or kind of high level government, how that connects down through regional level to actually make change on kind of community delivery. Because quite often the pathways are quite, even if it is mentioned, it is not articulated well enough for the pathways or the routes for funding to actually cascade right down into being community delivery. And that then causes frustration. And I think some of that, again, frustration is around progress made, language. For people who've been in this sector for a long time, it's feeling like that same conversations happening, things we already know. And then we had a bit of a conversation as well about the evaluation or the value of this sort of practice, and the greater demands made on a localized level for individual projects, individual practitioners to have to evaluate and evidence their work, when in actual fact there is much broader, bigger pieces of evidence that already do that, which means it shouldn't necessarily be a layer that's added to every single project that's being delivered on the ground. And the difficulty of some of that when we're talking about prevention is, how do you prove or evaluate something that doesn't happen? Because the prevention piece, when it works, is that people aren't getting to being in GP surgeries or hospitals or medication or all these different areas of impact. If they're not actually getting there because of this area of practice, how do we actually prove that impact? Yeah. But again, we all know it's true. So sometimes it's maybe trying to move the conversation from how do we prove it to an acceptance of that. We all know it already. So how can we actually move to the next bit of the conversation, which is actually supporting this area of practice and more work happening?
Absolutely. And just on that point, I think there's something about, we know it's important, we have the data. I think it's also about the relevancy we have to keep lobbying for. I keep saying that we actually are relevant to DWP to make people viable economic citizens. We're relevant to DHSE, DCMS. Obviously, we're talking here about mainly government departments. We're relevant to so many various government departments. We have to be seen as that middle bit in the rock that actually glues it together. Okay, that's been fantastic. There's so much brilliant chat in the chat. I feel like I can't quite keep up with it all. There's so much great conversation happening. I hope we're all finding a way through the chat and maybe emailing people as things are happening, which I love that connection happening. So let's move on to the second part. I'm going to ask the panelists to make sure they keep it pithy, let's say 2 minutes each. And we're going to move to our second question. And the second question is, what's your organisation doing in response to these challenges and all the opportunities? So let's kick off, Victoria. Let's go first to Creative Health and Wellbeing Alliance and yourself.
Thanks, Anita. Okay, so I talked before about the ways in which Creative Health sort of tends to push against the political tide. I think the whole point of having the Culture, Health and Wellbeing Alliance, like all the other networks that are here, is about trying to give us a bit of collective strength in that endeavour. So a lot of what we do is about trying to bring people together. There are various communities of practice that we run. We've got regional leads at the moment in Barnsley and South Yorkshire and Derbyshire. That's all about trying to sort of develop local networks, local communities of practice. And we do a lot of gathering and sharing information online, as you know, but we've also just had our awards, and that although notionally that's a competition, really it's set up so that we can see each other's work reflected in those awards, I think, and get that sense of being part of a larger movement. Even if we're not necessarily working in close collaboration with other people in the Alliance, it's a way of sort of feeling part of something, which feels really important. You picked up on that question of language earlier, Sunita and Anna. And a lot of you will know that we produced a quality framework last year for creative health, very much in collaboration with people who do creative health. So there are about 200 people involved in developing that. And in some ways, it's a mechanism for building that shared language that we can all get behind. I'll post that in the chat in a second, in case you're not familiar with it. And I think that goes with a lot of other big publications that have come out recently, like Understanding Creative Health in London, like the Creative Health Review. All of that is about kind of making the work more transparent and comprehensible and making it easier for us to coalesce around something. Another key point is about practitioner wellbeing, and that's been a theme ever since I started at the Alliance, and we're doing more and more work in that space. We're about to publish a new set of resources about supporting wellbeing. And just a very quick point, we're just about to launch our Equality Action Plan, and that is also about how we situate this work in relation to other movements, so that it's about sort of helping us to feel that creative health, while in itself it is a broad movement, we're also part of even broader movements for social change. So how can we work with organisations who are focused on social justice, on climate justice? We're all broadly aiming in the same direction. So are there ways that we can support each other and try and achieve those similar broader goals? We've done quite a lot of that work already with the Arts and Social Outcomes Network, which led to a really helpful manifesto about lived experience and pay, for example. So I think probably the most useful thing we can do as an alliance is to bring people together to try to sort of argue together for broader social change. Stop there.
And your point, Victoria, about broader movements of social change links to what I just said about the different government departments. Actually,
Absolutely.
We also in the arts, at a certain level, I think we're brilliant at thinking about ourselves in the charity sector. At other levels, and I've worked in big institutions, they actively pull away from talking about work being part of the charity sector, which is such an odd concept. And we need to be part of that VC, FSE sector. We need to be talking about that.
Yeah.
So let's move over to the right order of things. Let's go to Anna now, London Arts and Health. Over to you, Anna.
Thanks, Sunita. I mean, that was really articulate, Victoria, and I definitely think there's some shared actions there that we're also kind of taking at London Arts and Health, which is amazing, and kind of gathering the sector and really listening and holding space for the sector, which is actually so important. I wanted to just touch a little bit, because I talked about training initially. So there's a couple of kind of really proactive things we're doing this summer. The first is on Friday. We're going to launch a really short survey with City University based in London, but we really invite responses from across the country. And we're just really conscious that lots of practitioners ask us for training. They want to know what the best trainings are to do. Training is often like really expensive and really inaccessible. So City are really interested in co-producing with London Arts and Health's members some short CPD accredited training in creative health. So again, some of those kind of toolbox skills that you might need. And they also obviously have a really good partnership with St. George's Hospital. So there's a kind of on-site sort of medical aspect there as well, which is brilliant. So we'll be launching this survey just to understand, like, how much do people want to pay? How do they want training delivered? What is it that they want upskilling and support in? Just so we can really drill down and really understand from our members and from the sector what the need is. And the second thing that we're going to trial in partnership with the Royal Albert Hall, actually in person, is a creative health intensive week. So like a summer school in July. So again, this is maybe going to be developing a bit more some of those toolbox skills, but also the idea of that core competency. And when you're working with a group of people, trying and testing something out. And this will be, the idea is that for some members, they can come for the whole week and kind of immerse themselves, but there'll also be drop-in days. So we just, again, want to bring our sector together, offer training from really, really brilliant practitioners already embedded in the sector and kind of sharing those skills out at a really affordable price. And there'll also be bursaries. The second point I talked about was representation. So again, we can't solve this, but what we hope in our organisation is that we're providing some frameworks and ways of approaching and thinking through some of these challenges and offering some solutions. So we run a couple of trainings. The first is the Artists Represent Recovery Network, and that is a cohort of 10 ethnically diverse practitioners who are trained and learn about creative health over a process of 6 months, working with Raw Material and Arts and Health Hub are the co-delivery partners. And it's funded by the GLA, by Bearings and by the Arts Council. And this is the second iteration of this model. And the cohort also go on placement with really fantastic organizations. And they're also kind of networked and supported in building relationships with the sector, opening the doors into the sector. And the second thing is ARCH, so Advocates for Representation in Creative Health. And we soft launched that yesterday. It's chaired by Dr. Tola Dabiri. He used to work at the National Academy of Social Prescribing as the culture lead. And that, again, is a kind of space, a solidarity space, but also a space where we're figuring out how we can make the sector more representative. What are some of the actions? What are some of the tangible things that we can all be doing? And that, again, will hopefully be a model that can be picked up and spread around the sector to do that. So yeah, I'll hand back to you, Sunita. Thanks.
So much there as you were chatting, Anna. I was sending emails and WhatsApps of going, oh my God, I want to go to that. I must connect back to Tola. So great to see so much happening. Thank you. Let's hand over now to Laura and Guy, your response to that.
Thanks, Anita. Am I going first? So I was talking about the challenges of remaining sort of visible and relevant in the face of all this uncertainty, both in the health sector and in the arts sector for us. Alex talked about sort of churn and change and needing an agile response. And I think that's really what the National Arts in Hospitals Network can provide for anyone working within hospitals. So at the moment, there are lots of our members, particularly in England, who are looking at their jobs in a slightly concerned way because they're funded by trusts, and obviously some of these funding cuts will directly impact them. So our network is gathering together all the feedback we can from regional groups to try and put together a national picture of what this looks like for our members. Once we know what that looks like, we'll then start to look at what support we can offer, what advocacy we can provide. We'll work very closely with CHOA and NCCH to see how we might be able to bolster up that support from them as well. I think the evidence is there that this works. We've got evidence ourselves. We know this is a valuable thing. The trusts know it's valuable, but the knee-jerk response when the funding goes is to look at arts programs. It's a weak spot in the system, and we're aware of that. But having a national network, having that support from other people in the same position, I think is really valuable. So that is one thing we are doing, is gathering that information and working to advocate. The peer-to-peer support is invaluable because most arts managers work on their own in a trust, or they have a small team. There's a lot of isolation, lots of siloed working. So as a network, we put on 3 events a year where people can come together from the hospitals and share best practice. And I think that really gives us that resilience that we need in this constantly changing environment. We've got a new toolkit. Everyone seems to have a network and a toolkit these days. Our toolkit is launching in July, and this is a really comprehensive guide on how to, sort of dummy's guide on how to set up an arts programme in a hospital. So that, I think, will be really useful at this time for any hospitals out there who are just starting on this journey. And there was somebody in our group who was in exactly that position. To have access to this material that's been written by the arts managers in the UK with the help of the amazing Jane Willis. It gives you everything you need on how to do this, how to set it up, templates for contracts, templates for artist brief. So hopefully we can make it easier to set these things up, to keep them going, make it more professional, make it more robust, and to help with that fragility that Salah was talking about. So overall, I think the network is just providing that strength and resilience. I shall hand over to Guy. Thank you.
Thanks, Laura. I'll be really brief and just give a very kind of practical example of how we're trying to address this idea of creative health and preventative health, and exploring how hospitals are engaging this within this space. I mentioned how there was a challenge around neighbourhood-based and place-based approaches to working, and thinking about how we can join up more in the kind of preventative strategies, really through partnership, working with ICBs and other local arts organisations, etc. So in a really very practical way, as Laura said, NARN has regular members meetings, 3 members meetings a year, where we come together, share best practice, and show example case studies. Our next session is on the 2nd of July, and as part of that, we're going to be having a session where we've invited Paul Allen, Assistant Director of the Strategy in Communities and Inequalities for Camden ICB, and Joe Reeder, who is also Assistant Director for Place Integration, Transformation and Delivery, and also some creative health practitioners working in community health, bringing them together and really just providing an opportunity to spark conversation with colleagues working in hospitals. And I think that's really kind of one of the key things that that the networks offer, is that ability to advocate, that ability to influence, and that ability to bring people together for that conversation, for that collaboration, to assist with kind of moving that change forward. I think what's been really apparent to me is that actually, speaking with ICBs, not everyone knows about creative health, and that might come as a surprise to some people. But actually, opening the door to those conversations has been incredibly rewarding, and I think there's a real desire and enthusiasm for colleagues within ICBs to work more closely with hospitals. So I'm really excited about our kind of forthcoming event and what this space is going to be offering. Thank you.
Great, thank you, Laura and Guy, so much. Let's move on to Claire. Can we move on to...
Thanks, Anita. Can you hear me? Because I've had to shift rooms. Yes, you can. Brilliant. Okay. So as a new network, the key thing that we want to do, and which has been mentioned by many of you here already, is that we really want to harness the power of the collective. So what are we going to do to leverage our skills and expertise and the networks so that we work together to address the sustainability of this really vital area? From our meeting in Birmingham, the 4 areas that we're looking at working on over the next 18 months is to explore policy alignment and cross-sector collaboration. So this practically means developing a creative health investment framework, and that investment speaks to people, infrastructure, policy and programs. And we're already starting to look at how this work is embedded into our own regional growth plans and health inequality strategies. The second area is looking at advocacy and communication. So exploring how we create a co-designed national campaign together with our other colleagues here on the panel that shifts the creative health sector from a nice to have to a need to have. You won't be surprised, but evidence building is one of the 4 areas, but focusing our combined efforts on making the economic case. And then finally, looking at the issue of capacity building for organisations, artists, and also ourselves, so that we build this as a really thriving sector. And I just wanted to give a brief example from the start of Creativity and Wellbeing Week on Monday, when I attended the launch of Croydon Council's Public Health Annual Report, which for the first time focused on creative health. In his introduction to the report, Jack Bederman, the Acting Director of Public Health, posed the familiar question that we all hear. Why talk about the arts when there are urgent issues demanding our attention? The NHS is under immense pressure, council finances are stretched to the limit, and communities are struggling. Surely now isn't the time. But in the report, he flips the answer. What if now is exactly the right time? So for us, it takes bold and courageous leaders at strategic level, working hard to position and reposition arts and artists at the centre of working together with our health and social care colleagues to really imagine that shift from acute to prevention in the new NHS proposals. And that's what our new network is aiming to do with everybody, is to harness that power of the collective. And I think that's as pithy as I get.
Pithy with great acoustics. Thank you, Claire. Moving on to Alex. I'm sure there's enough time for another breakout session. Alex, over to you.
Actually, it's Jane who's going to respond.
Apologies, over to Jane.
Hi, Jane Howard from the National Centre for Creative Health. Really echo everything that my colleagues have said, and we're definitely working with all those colleagues in the ecosystem to support the work that as it moves forward. I mean, firstly, many of you will be aware that we've just completed a 20-month Arts Council funded programme of Creative Health Associates, which has really proven to us to be a really valuable learning experience. It showed us what's possible when we have dedicated roles embedded in health systems. And we're now sort of taking that pause to use the insight and the learning from that to shape what comes next in what we all know is this time of tremendous change and flux within systems. But exactly sort of following off from what Claire was saying, it's about how can these roles be used to support that systems change that's happening, not working against it or not seeing it as a barrier, but seeing it as a real opportunity. So we're exploring those new roles. What might they look like? This means being really pragmatic and flexible, recognising that every system is different. They're at a different stage of readiness for this work, a different stage of awareness, even an understanding of it, as Guy said, and recognising that these roles need to align with the very particular local context of local partnerships and local priorities. So again, they need to be embedded in that system so they understand what those what those particular priorities and partnerships are. I think also building a little bit on what Guy was saying about the differing levels of awareness within systems, we're also focusing on communication with the health and care system and health and care professionals. As we know, people working in that system are time poor. So we're developing some really short, clear resources that guide people from moving from a sort of, why should I care about creative health? What is it anyway? Through to, okay, I'm interested, tell me a bit more, to the sort of, how can I implement this within my team, my organisation, my system, and signposting them to the relevant evidence, resources and guidance at every stage that's appropriate for them. So we know there's plenty of evidence out there, but we need to make that really digestible for people for whom this is something new and they haven't got a lot of time to spend on it. And we're aligning all of that with, as you've heard, the 3 shifts in the system, the shift to community, to prevention, to digital and technology, and especially also thinking around place and neighbourhood working. So we'll be showing how creative health can contribute to those shifts and how it can contribute to the broader 10-year plan priorities when those are published. We're also working, as Alex mentioned, we commissioned a report around commissioning of creative health, and we're looking at how can creative health providers better access commissioning opportunities within the NHS. So that report that we commissioned will be published very soon, and it explains how the process works and where creative health can play a meaningful role in that. And it does very much support the idea that creative providers do need to be sitting alongside colleagues in that wider VCFSE sector. We know that there are real challenges there, particularly around capacity and resourcing within the creative sector to take on that work. And again, this is where some of these roles, the creative health associate type roles, which we see very much as bridging roles, bridging the sectors, enabling them to talk to each other more effectively, to understand each other more effectively. Those roles can really play, can have a great impact there. And then finally, we're committed to sharing what we've learned with the system, with both the health and care system and health and care sector and those working within the wider creative and cultural sector and with our colleagues here. So we want to contribute to the training and development that we've heard about at different levels, sharing what we know about the system, but also thinking about how do we equip more people to take on some of those more bridging roles. So there's the whole issue of capacity and training and development for people delivering creative health, but also for those people to take on those broader bridging roles. Thanks.
Thank you, Jane. So important. Those roles have been absolutely key, and I'm really looking forward to them continuing in the capacity they can. So feedback from chat. Here we go. Challenges. Oh gosh, it's really fast. Winning hearts and minds of the public, as well as link workers, social prescribers, highlighting the benefits. I was in a chat yesterday about, link workers and social prescribers. They can't know about the successes of every element of social prescribing. There's lots of different pillars and themes, and actually we need to potentially be better at socialising it with them. We've got email addresses of people there, so please do get in touch with people. The importance of joining up or attempts to mapping and the postcode lottery, such a key thing. I only know to get my mum to singing groups. My mum has dementia because I've done the research and there's things going on in my local libraries, but actually I don't know what's happening in other parts of London. There is a bit of a postcode lottery. We put this in the breakout chat just as we're ejected. I'm really sorry, Mark. The new report from Spirit 2012 on measuring wellbeing and cost effectiveness, really good to have that. Thank you so much. I'll definitely be having a look at that. And actually that return on investment, I hate to sound so corporate, but that ROI started to become really important. The change to prevention and support in the communities are becoming need to be read. You're absolutely right. Upstreaming is a really soundbite at the moment, isn't it? But actually measuring upstreaming is really difficult, measuring prevention. The challenges of funding. One thing I want to say is I'm going to be doing a piece of work with Arts Council actually around looking at new funding models, because one thing I find is that people are recycling money, but actually we need to find new money. We can't keep trying to find money from other pots, because pots are getting they're drying up. So we need to find new ways. Different funding streams talk to each other. I completely agree. It's really. I spoke to a funder recently where I put in a budget for a creative health project, and they said, "Gosh, it's quite an expensive one." And my answer to that was, "It's because it's expensive and we're paying people properly." And so I think that idea of days where we just do things on a shoestring, people aren't paid properly, isn't the right way. Changed our model of operation, but we're not fighting for resources. Kinder producing model, I'll definitely have a look at that. Look at tailor specific resources for the real world context. And that's really important, isn't it? Being able to take something and literally drop it into the reality that we're looking at. Great chat about the importance of bringing together education from early years. Absolutely, social prescribing and hospital arts programs. So starting really early. That is absolutely that's absolutely upstreaming, isn't it? We've got some links there about evidence reviews. Seeing social prescribers report about where there was a question: how many people have stopped using the GP or A&E? There isn't a creative health organisation that can measure that. We need to work with academic. Yes, absolutely, and I'm trying to look at that with the UCL partnership with NASP around the National Centre for Social Prescribing Data. Messaging value investment with impact on creative health, being confident. I think that's one of the, if I start doing a bit of a wrap up now, my 3 takeaways from this is about the confidence of the work that we're doing, and the fact that the people we are working with and the people that we are who are working in this sector, there is a real strength and there is a real passion, but also there's real data and evidence behind it. There is a deep faith in the work that we're doing, but there is the evidence that shows it works. So I think that point about being confident about it is really important. I think there's something that people are saying about there has to be a shift change around funding and how we talk about what the kind of funding that we need. But linked to that, some of the funding will be around semantics and language and how we use language in different contexts. And then one thing that I think that keeps coming up is about community, and how actually we need to not only be recognising the government shift from hospital settings but to community health, but also in relation to prevention and the work that's happening in a really hyper local grassroots level. So I just want to say a massive thank you to you all. There is so much happening in the conversation, the chat. It's absolutely brilliant. I think, am I right, Victoria and Kayla, you might do a bit of a summary of all the links and send that out to everybody who's been here, so you don't have to trail through all the conversations. And also, yeah, just the point there, we've been turned down on funding because we said perhaps we're paying enough. It's absolutely fundamental. There's a fiscal value to what we do, and there's also an inherent human value to what we do. And I think that's really important that we all take that away. So thank you all for your input. Thank you for your thoughts, your comments. Thank you to the panelists. Thank you to London Arts and Health Forum for Creativity Wellbeing Week, and to all the other organisations who are leading on that and delivering events. And please do all keep in touch, and we will all see you soon, I'm sure, in another event. So thank you again, and lovely to connect to you all. Cheerio.